I think it's really important that people think about the board's role in preserving and protecting self-regulation at a time of change. Because so much is changing, the board needs to be active in changing too, otherwise it will be people, not physicians, who drive what all the expectations are for physicians. The mission of the American Board of Internal Medicine is to improve the quality of healthcare by certifying internists and subspecialists who demonstrate the knowledge, skills, and attitudes essential to excellent patient care. We fulfill our mission by helping doctors communicate to the public ways in which they have knowledge, they have skills that other people don't have. The core value of the credential is to signal to the public that somebody's different than somebody else by virtue of their training, by virtue of their knowledge, by virtue of their practice. Many people question whether there's any evidence that MOC improves patient care. We have an evidence summary on our website. It's not randomized controlled trials, but lots of what we do in healthcare is not randomized controlled trials. We do some things based on that level of evidence. We do other things based on more of a preponderance of the evidence. That physicians need to maintain their skills really can't be questioned. That skills decay over time really can't be questioned. We have evidence for both those things. We have evidence that physicians participating in our programs achieve better outcomes than physicians who don't. It's not the most robust evidence in the world, but it's evidence. We're in the process of continually improving and upgrading the evidence base as the program changes, and we're committed to evaluating the impact of the program changes over the next few years as we put them into place. Physicians are very interested in telling us at ABIM how we're doing, and we are very interested in hearing from physicians about how we're doing. We've created a program called Assessment 2020. There's a committee that is trying to address the question, what are going to be the skills for the physician of the future? We're running blogs and regular commentaries on that, and we're inviting reaction from the community. And there have been some very robust discussions on the Assessment 2020 website. I've read them myself personally. Other leaders here at the board are paying attention to what people are writing on Assessment 2020, and we're following survey data and following letters and correspondence and emails that people send to the board. We're very interested in what the community thinks about the program, tracking it closely, and evolving the program, very much informed by what we hear.